Okay, we're going to start the cranial nerve exam with the olfactory nerve. I'm going to test this nerve with smell. If she were to have an inability to smell this scent, it's known as anosmia, and it can also be accompanied with a loss of taste. Okay, so close your eyes and cover one eye. Smell.
Vanilla.
Okay, now switch. Smell.
Vanilla.
Yeah. For the next part of the exam, we're going to test the optic nerve. We're testing acuity. We're going to use the Snellen chart, and the first number indicates the distance from the chart, and the second indicates the distance at which a normal eye can read the letters. In the event that we need it, yeah. She could use a Rosenbaum card as well.
Wait, am I really supposed to take off my glasses?
This is the chart. She's 20 feet away. Cover one eye and read the best you can.
I can't read it.
Anything?
No.
You can't read any lines?
No.
Okay, switch eyes. Anything?
No. I know it's an E.
This
but I
is
can't see it.
this is why she has glasses. Next, we're going to test the optic nerve for the visual fields. We're going to have her test her peripheral vision in all 6 fields. So cover one eye, or close one eye, whatever's easier. Let me know if you can see this.
No.
You can't see it? It's right in front of your face.
No, I can see it.
Okay, well.
I don't have peripheral with my glasses on.
You gotta take the glasses off, I guess. Okay, I'll do it.
Okay.
Ready?
1, 2, 3. 1, 2, 3.
Okay, switch eyes.
1, 2, 3. 1, 2, 3.
Perfect. Okay, next we're testing cranial nerve 2 and 3, the optic and oculomotor nerves. We're going to perform a direct and consensual pupil reaction test. I'm going to, oh, you're locked in. I'm going to have you stare at a point in the distance.
Okay.
And I'm going to first do a direct test and see if her eye constricts with me flashing the light in it. Oh, it did. Now, for an indirect test, I'm going to splash the light in the same eye and check the other eye and see if that constricts. It did. Good. Now we're going to switch eyes. Keep looking at a far point. Oh, wow. Okay. Perfect. If there were a lesion in her cranial nerve 2, both eyes would constrict with light stimulation on a normal side. Oh.
Okay.
Okay. If there were any lesions in the cranial nerve 2, both eyes would constrict with light stimulation on the normal side, but neither constrict with light stimulation on the lesion side. And for a cranial nerve 3 lesion, only one eye would constrict with light stimulation on both sides. The lesion on the eye that does not would be on the eye that does not constrict. Next, we're going to test the cranial nerve 3, oculomotor nerve, cranial nerve 4, the trochlear nerve, and cranial nerve, is it 6? What? Oh. Next, we're going to test cranial nerve 3, the oculomotor nerve, cranial nerve 4, the trochlear nerve, and cranial nerve 6, abducens. In this test, we're going to look for ptosis, pupil sizes, and blepharospasms with the eye closed. Okay.
Let's check for all of this.
I'm looking at her eyes. There's no ptosis. The pupil sizes are even. Close your eyes. Oh, there's no blepharospasms. Next, for ocular motor nerve 3, we're going to do a convergence exam to look that both her pupils are abducting and adducting symmetrically at the same time. That would be a normal findings. A lesion in the eye would suggest that it fails or is slow to abduct or adduct. So look at this pen. The eyes converge together. Next, we're going to perform an accommodation test to observe for the lens and their change in thickness when focusing between near and far locations. So on the left side, I'm going to have you look at my finger and then look at the wall 3 to 4 times back and forth. Okay. Now we're going to try this side.
I can't even see your finger.
Sorry. On the right side. Oh, left side. Okay. The change was equal. Next, we're going to be doing clinical testing for the ocular motor nerve, the trochlear nerve, and abducens. We're going to test the muscles that perform each actions when observing. It'll be called an H and X in space test. Before we begin the test, I'm going to say what nerves innervate each of the extraocular muscles. Cranial nerve 6, abducens, is the innervation for lateral rectus. Cranial nerve 4, the trochlear nerve, is the innervation for the superior oblique. And cranial nerve 3, the ocular motor nerve, is for everything else. The inferior oblique, medial rectus, superior oblique, the superior rectus, and the inferior rectus. Okay, look at me. We're going to test the superior rectus first. Look up at my finger. Now down to the inferior rectus, inferior oblique, superior oblique, lateral rectus, medial rectus. Next, we're going to test the trigeminal nerve, that's cranial nerve 5. We're going to perform sensory exams, and it's important to note that each division of the trigeminal nerve includes ophthalmic region, which is V1, V2 is the maxillary region, and V3 is the mandibular region. To start the exam, we're going to test the masseter and temporalis muscles. For the masseter muscles, I'm going to place my fingers on the muscle and instruct you to clench your jaw or chew. Perfect. Now for the temporalis muscles. Oh, perfect. I felt them flex. Next, we're going to test the jaw opening muscle strength. I'm going to instruct the patient to open their mouth, place one hand on the top of the skull for stabilization, and one on the bottom of their jaw. Now resist closing your jaw. Perfect. Good strength. Okay. Then we're going to test the jaw reflex. With my non-dominant hand, I will put my thumb on the patient's mouth. That's open. Just relax. You don't have to keep it open, just relax it so it'll fall open. Okay. And then I'm going to hit it 2 to 3 times to test their reflex. Okay, the jaw moved upwards, good reflex.
Did it? Actually.
Next, we're going to test the corneal reflex for cranial nerves 5 and 2. I'm going to poke the cornea gently with a piece of the cotton, not the sclera. And it's important to know that cranial nerve 5, the trigeminal nerve, is the afferent or sensory portion, and cranial nerve 2, the facial nerve, is the efferent or motor portion of the reflex. Now we're going to test for reflex. I'm going to have you look at this side, and I'm going to gently graze your cornea. Perfect. Now I'm going to do the other side. Also, cranial nerve 7 is the facial nerve, not cranial nerve 2. For the corneal reflex, cranial nerve 7, the facial nerve, is the efferent or motor portion of the reflex. Now, to continue to test cranial nerve 7, the facial nerve, we're going to correctly test the muscles of the facial expression. And the facial nerve also supplies taste to the anterior 2/3 of the tongue, but we're not going to test that. For the facial exam, I'm going to have the patient close her eyes tightly. Okay, now elevate your eyebrows, puff your cheeks, and give a little smile. Big teeth. Perfect. Looking for symmetry, and it was there. Now we are going to move on to cranial nerve 8, the vestibulocochlear nerve, and we're going to begin with the test, which involves rubbing my fingers to see the capability of your hearing. Can you see it? Okay. Can you hear it?
Yeah. There.
Okay. Ready?
Mm-hmm. There.
That's pretty symmetrical. Okay. Next, we're going to perform both the Weber's and Rain's test. We're going to be using a 512 hertz tuning fork, and a normal result for the Weber test would be that it gives no lateralization. The lateralization would be an abnormal finding and would warrant a further investigation with Rhine's test. But for this test, we're going to perform both tests anyway. And a normal finding for the Rhine's test is that the air conduction would be greater than bone conduction. Now, to begin with the Weber's test, we're going to, again, use a tuning fork of 512 hertz. I'm going to gently hit it on my forearm and ask her if she can hear it. Okay, ready?
Mm-hmm. No.
Yeah, I'm gonna hit the table because... Was there lateralization?
Yeah, this year.
So this, since she had lateralization, this will warrant a Rhine's test. I'm going to, again, use the 512 hertz tuning fork to begin the Rhine's test. I'm going to place the end of the fork on the mastoid process until they can no longer hear it. Then I will flip the fork to test air conduction in the ear canal.
Can't hear.
I heard it when it flipped.
Did you?
Yeah.
It's fine.
You want to do that one? On the mastoid process.
Can't hear it.
Good. Turns out she can hear well. Part of the vestibular cochlear nerve is to test balance, so we'll be doing a tandem gait exam. But first we're going to test for resting nystagmus, which would be rhythmic eye movements that occur when a person is looking straight ahead. These would be involuntary movements. So we're going to check for resting nystagmus. I don't see resting nystagmus. So now we're going to move on to the tandem gait exam, and that would be when the patient will walk to me with heel to toe with their eyes both open and closed. First, walk with your eyes open. Good balance. Okay, now go walk with your eyes closed, heel to toe. Don't fall. Well done. Now we're going to check with her visual fixation with a head impulse test. For a normal exam, visual fixation is maintained, but a loss of visual fixation could indicate a lesion of the ipsilateral side of which is rotating. Okay, look at the tuning fork. Now look to the wall, but maintain your, there you go. Turn your head this way. Perfect. This would indicate that she has no lesions. Next, we're going to test cranial nerve 9, the glossopharyngeal nerve. It does provide taste to the posterior 1/3 of the tongue, but we're not going to test taste today. But we will perform a gag reflex. The glossopharyngeal nerve is the afferent and sensory portion, while the vagus nerve is the efferent and motor portion of this reflex. Okay. Open your mouth. There was a gag. We're good. Now for cranial nerve 10, the vagus nerve, we're going to test the patient's swallowing. I'm going to place my hand here. Okay, I need you to swallow. Come on, you can do it. Take 2. Okay, swallow. Perfect. Felt even. We're also going to assess for palate elevation lesions. A lesion would prevent one side of the palate from elevating properly and causes ipsilateral deviation from the uvula, meaning the uvula would point away from the side of the lesion. For this test, I'm going to have the patient open her mouth and say ah, and I will look for elevation on the palate.
Ah.
Elevation is even. Next, we're going to test cranial nerve 11, the accessory nerve, which is the innervation for sternocleidomastoid, or SCM, and the trapezius. To test the traps, I'm going to have you elevate against my hand. Perfect. Perfect. For the SCM, I'm going to have you press against my hand. Okay. Perfect. Movement was even. It was tested bilaterally but individually. The last part of this test is to test the cranial nerve 12, the hypoglossal nerve. We're going to be observing the tongue for atrophy and facilitation first. Fasciculation, sorry. To test for fasciculation and atrophy, I'm going to use a light and examine the tongue at rest. Please open your mouth. A little wider. The tongue looks good. And then I'm going to perform a tongue protrusion test. And the tongue will deviate to the side of a lesion if there is a lesion present. So please stick your tongue out. No deviation. And to test the tongue muscle strength bilaterally, I'm going to place my hand on either side of her mouth and feel the strength of her tongue. Okay, perfect, switch. Perfect. If there is a weak side, it would be contralateral to the lesion. Okay, I know we just finished with cranial nerve 12, but we're going to go back to cranial nerve 5 and test the trigeminal nerve divisions. We're going to perform a sensory exam with a cotton ball and a pinwheel. First, I'm going to test the first division, the ophthalmic division. Can you feel that? Yeah?
Yeah.
Now, do you feel the difference? Okay, ophthalmic region is good. Next is the maxillary zone. The glasses. Can you feel it? On the maxillary zone?
Yeah.
Okay. You feel this? Yes? Perfect. And the last zone is the mandibular zone. We're going to test with, again, the cotton ball and the pinwheel. Do you feel it? A little face massage. Good?
Yeah.
Yeah, good. We're going to be using an ophthalmoscope to test the optic nerve and look at the optic disc. That's what we're going to be examining. When we are examining the optic disc, we're going to be looking for sharpness or clarity of the disc outline. If it's blurred, it could indicate papilledema, which is caused by intracranial pressure, and a result of the intracranial pressure could be a tumor. While we are examining the optic disc and the eye, we are also going to be looking for any lesions in the retina, and we're going to be observing the arteries and veins for any abnormalities as well. To use the ophthalmoscope, first I'm going to turn it on. It's on. I'm going to stand at a 15-degree angle and observe the eye with them looking at a fixed object in the distance. Eyes ahead. I'm going to get a little close now. Oh, that's kind of cool. We're going to observe the other side as well. There's no presence of lesions or abnormalities.